Welcome. I'm Meryl Chertoff, Director of the Aspen Institute's Justice and Society program, and delighted to welcome you to another of our lunchtime discussions on critical issues in law and public policy. Past programs have looked at the Supreme Court confirmation process, the proliferation of legal rules and the possibility of legal and statutory simplification, and the Supreme Court's ruling in the Caperton and Citizens United cases and its effect on campaign contributions on the independence of state judges. Today, we're going to talk about the Affordable Care Act and litigation that has been brought against it. We're delighted that we have the Governor of the Commonwealth of Virginia and the former Governor of Pennsylvania here to discuss this important issue. There are 4 lawsuits currently pending, one brought by the Commonwealth of Virginia, one brought by the Attorney General of Florida and 21 states and governors, and one each in Michigan and Florida brought by private parties. The decisions of the district court so far are split 2-2, and Governor McDonnell, when he arrived, told me that this morning the Commonwealth and other governors have filed a request with the Justice Department urging expedited review of the case by the U.S. Supreme Court, bypassing the usual stop at the Circuit Court of Appeals. The key constitutional provision relates to the individual mandate provision of the Affordable Care Act. The administration has argued that for the broad-ranging provisions of the new law to work, every American needs to purchase insurance unless they're eligible for the 2 existing public programs, Medicare and Medicaid. The premiums from healthy people who make little use of the system can then pay for the care of the sick. The constitutional challenge arises under the Commerce Clause, which allows the federal government to regulate interstate commerce, reaching its high water mark during the New Deal. With a 1995 Supreme Court decision in Lopez, the Commerce Clause has been interpreted to have broad but not unlimited reach over the regulation of commerce. The question is this: is there an interstate commerce impact from inaction? The person who does nothing, who does not buy insurance. And maybe when he needs medical care, he self-pays. Maybe he becomes an uncompensated care recipient. The question on its way to the Supreme Court is whether that inaction is enough to trigger the Commerce Clause. Other related issues are whether, if the individual mandate fails, the rest of the Act survives. And embedded in all of it is the question of the appropriate balance of power between federal and state government and the urgent need for reform of our healthcare system. The litigation is a reminder that even the most brilliant plans from a policy perspective are still subject to the constraints of our U.S. Constitution. Those are the kinds of issues that we at the Justice and Society program study. Nobody could be better at moderating today's discussion than Jeffrey Rosen, professor at law at George Washington University and legal affairs editor of the New Republic. He's the author of numerous books, including The Supreme Court, The Personalities and Rivalries That Defined America. Jeff, welcome.
Ladies and gentlemen, it's hard to think of a more exciting and momentous constitutional debate than the one that we're about to discuss today. Proponents of the constitutionality of the healthcare reform say that it is a clearly legitimate exercise of Congress's power, and to strike it down would be to call into question an understanding of Congress's power to regulate the economy that would bring us back to a pre-New Deal or maybe 19th century understanding of the scope of federal power. By contrast, opponents say that the Obama bill is an unprecedented expansion of federal power. Never before has Congress regulated inactivity, and if this bill is upheld, they warn, Congress could force us to buy broccoli or gym memberships. So to sort out this fascinating question, we have the 2 leading participants as well as constitutional thinkers in the country. I'm going to put both of you gentlemen back to law school and run you through all the cases you wish you'd forgotten from first year. We have the governor of Virginia and the former governor of Pennsylvania. Governor Bob McDonnell is the 71st governor of the Commonwealth of Virginia. He's a graduate of the University of Notre Dame, of Boston University, and Regents University, former member of the Virginia House of Delegates, and the 44th Attorney General of Virginia, and we're delighted to have him.
Thank you.
Governor Rendell was governor up to a few weeks ago, and he is adjusting to the pleasures of being liberated from public service. He served 2 terms as the governor of Pennsylvania. He also chaired the National Governors Association. He was the former attorney of the city of Philadelphia, the general chair of the Democratic National Committee, and he is a graduate of the University of Pennsylvania and holds a JD from the Villanova Law School. Gentlemen, I think with your indulgence...
Another fine Catholic university. That's right.
Oh, absolutely. If I could ask you, Governor McDonnell, just to make a brief opening statement about what you think the constitutional stakes of this great debate are.
Well, thank you, Jeff, and Walter, and Merrill. I really appreciate having a chance to be here on certainly one of the most talked about issues in America today with Governor Rendell, who was a good leader for his state for many years. My home state. I was born in Philly.
That's right.
So nice to be with the governor. The question is not whether or not the federal policy is a good idea, because I think there's broad agreement that greater access at lower cost with more innovation is something most people agree on across the political spectrum. The question is, can you enact a policy in a way that honors the Constitution, and is this law constitutional? Because this is not a Machiavellian society. The ends don't justify the means. You've got to be able to enact policy that's consistent with the Constitution. And in this case, Virginia believes, and 26 other states also believe and have filed suit. Frankly, the first time in history I think we've had litigation between a majority of the states and the federal government that the exercise of Congress's power, in this case, under the Commerce Clause and under the Tax and Spend Clause, the two that the federal government is relying on in this case, are in fact power that exceeds the limits that our founders put in place some 2 centuries ago. Virginia actually filed or passed a statute that I signed last March specifically outlawing a mandate of insurance to be imposed upon the citizens of Virginia. It was one of the bases of standing in our lawsuit. And it comes really down to this. And I know we're going to talk about the negative and positive limits of the Commerce Clause power from Wickard versus Filburn 60 years ago till today.
Good, you've done your homework.
Yeah, a little bit.
Excellent.
Which I think was probably excessive. But this goes well beyond it. You can, even if you concede that Congress has the ability to regulate any activity that touches on interstate commerce, even if it's intrastate commerce, as the Wickard case was, this is trying to regulate inactivity. That is, your choice not to purchase a product of insurance, not to engage in commerce, and if you fail to do so, to enact a penalty, not a tax, even though that's the way it was originally sold, as it was not a tax. The fact is, it's not a penalty. In fact, is a penalty, and so that really is the issue. And I think both Judge Vinson in Florida, Judge Hudson in Virginia, got it right. And that is, the individual mandate is unconstitutional, because I really do believe this. You made fun of broccoli, or what was your other analogy?
Asparagus and gym membership. So the main thing people are afraid of.
You laugh.
Yes.
But I think if you can make somebody buy a product of insurance for whatever noble goal you might have, then what really are the limits left on federal power? Because then the Commerce Clause really can mean anything. Cannot gym memberships or broccoli or asparagus also, because they're good for your health? Why can't you mandate that? I mean, I think we have really torn down the last vestiges of limits on federal power. We've eviscerated the 10th Amendment if the statute is left to be left intact. So that's not to say there aren't some other good provisions in the law that we can talk about. And there are some things maybe the state could do that are similar to that, but not the United States Congress under the limits in Article 1, Section 8. So that, to me, is really the issue. The debate, regardless of what happens in the United States Supreme Court, the debate, I think, on health care reform will continue. It certainly is important to be able to increase access, reduce costs, improve innovation. We have the best health care system in the world, but that doesn't mean it can't be improved and expanded. The last thing I would say, I know we're going to talk about this, is I think this case, it's urgent that this case be expedited to the United States Supreme Court. I don't care what side you're on. I think the governor told me he might actually agree with this. No matter what your side you're on, we need certainty and finality. Individuals, businesses, healthcare providers are in limbo for perhaps years of litigation until this is decided. And everybody knows the United States Supreme Court is going to ultimately decide this case. So we filed a petition in Virginia yesterday under Rule 11 of the rules of the Federal Rules of Civil Procedure to expedite this case, to have it bypass the Fourth Circuit, go directly to the Supreme Court, let them decide this. Florida, I think, is going to do the same, and we had 28 governors send a letter this morning to President Obama asking him to direct the Justice Department to agree to this. So let's get it done. Either we don't waste money and don't have to implement it, or we do have to implement it and let's get on with the show. But either way, let's not have years of litigation. So I hope there's some broad agreement on that. But anyway, nice to be with you, and I look forward to the dialogue.
Thank you very much, counsel, for that excellent opening statement. Your opponent is the attorney for the U.S., representing the Solicitor General's office. Please, may it please the court, what is your response?
Well, hello, everyone, and it's a pleasure to be here to talk about what is really one of the seminal issues before our country right now. I was the district attorney of Philadelphia from 1978 to 1986, and I haven't practiced law in 20 years. The time I was mayor, Democratic chairman, running for governor, and governor. I haven't practiced law for 20 years, so I don't know what I'm doing here, to be honest. I also haven't driven a car in 20 years. And I think my driving is going to be more dangerous to the citizens than me practicing law again. But first, let me just say, I think this is an issue that's really infinitely too important for partisanship. The debate in the Congress was pitiful and shameful. The speeches on the conclusion, the night the vote was cast, were, I think, almost reprehensible. The charges, the counter charges. We can't deal with issues like this in America out of a sense of partisanship. You know, Bob says it's not a tax. Well, in fact, if you go back to the debate, members of his party, and I don't blame him for his statements made by members of his party, but were screaming and yelling that it was a tax. Well, is it a tax if it walks like a duck and quacks like a duck? It's a duck. It's a tax when it's convenient and a tax when it's inconvenient. If it's a tax, argument over. You know, Congress wins. The law is constitutional. But that's to be decided not by rhetoric, but by sound legal principles. But I think we've got to approach this. We've made a hash of it so far because of the partisanship. We've got to try to do better. And Bob told me, I didn't know, but that 28 governors, sadly all Republican governors, have filed this request to expedite the litigation. Were I governor of Pennsylvania still, I would have joined in that, because it is important to the country and important to the states that we get an expedited decision. Having the cases go up the channel to the appellate courts, we're likely to get divided decisions from the appellate courts as well. Depending to a great degree on who appointed the judges that populate those courts, sadly. So I think we need an expedited review. There's some theory that for the Democrats, there's a strategic advantage to have this going on longer. Once everything's all set up, courts are going to be reluctant to strike it down. I'm not sure that's right. Gosh, right now in Pennsylvania and Virginia and other places, the parts of the health care bill that have come into law are extraordinarily popular. You couldn't find a better time to be arguing for maintaining those things, because someone's going to have to explain, Governor McDonnell's going to have to explain if this law gets thrown out, why seniors are losing the $250 checks. By the way, do they have to give it back? Why, in fact, people all of a sudden, their children who had pre-existing illnesses that are now covered are no longer covered. See their coverage removed. Things like that. So regardless of where the political advantages lie, we need a quick decision on this. And the reason we need a quick decision is states literally have to put a lot of work and a lot of effort and a lot of money into getting ready. As governor, literally within weeks after the bill passed, I put a task force together and we started the process of beginning to implement our exchange. As you know, by 2014, states have to have exchanges up and running, or they have to defer and give the authority to run the exchanges to the federal government. I think most of us want, most governors and legislatures would want to keep state control over those exchanges. And there's a big run-up time and a lot of time, effort, resources, and money spent in building those exchanges. So that's an idea that we ought to do in a nonpartisan way. Get this case litigated with finality quickly. Secondly, although I'm happy to talk about the legal issue, I think we should spend some time talking about what happens regardless of what the court decides. If the court strikes down the act, even if it finds it to be severable, like Judge Hudson did, if it strikes down the provision and finds it to be severable, the act can't be sustained, and the Justice Department has admitted as such. You can't force insurance companies to give coverage to people with pre-existing illnesses, to have caps on the amount of yearly or lifetime coverage, things like that, without giving them an expanded pool. And so regardless of how the courts come down, if it's struck down, I think we've got to start from scratch. If it's upheld, there are clearly weaknesses in the law that ought to be amended, but amended in a bipartisan way. And I think it's incumbent upon Congress and the President to put aside electioneering, to get this thing done for the long-term benefits of the people. In terms of the legality, inactivity can have an effect on commerce and the economy as much as activity, because inactivity is not really inactivity. You are doing something. You are choosing not to have health care, and that has significant consequences. Your activity, you are making a choice not to have health care. That choice has economic repercussions. If you don't have money to pay for your own health care, you will go to an emergency room, and the cost for your health care will be distributed to all of us in every state in the union. If you choose to pay for your own health care, that has consequences, because it has consequences on the rates that are charged for others. So inactivity is not the right word. You are choosing to make a choice, and that choice is activity itself, which has a dramatic effect on commerce. Plus, I believe this should be construed as a tax and would also fall under the broad taxing power of the Congress.
Excellent, councilors. You've actually very well summed up the major arguments for and against this bill. Let us examine some of them in a little bit more detail, and then we'll turn to the policy matter. Governor, my ears perked up when you said that you thought that the Wickard case was probably wrongly decided. For the non-initiated, this may seem technical, but this, in fact, is at the core of the debate, because as you know well, Wickard and Filburn, right before the New Deal, said that even growing wheat in your backyard has an effect on interstate commerce, because if you consume it yourself, then you're not likely to buy interstate wheat, and therefore the interstate market is affected. You said you thought that case was wrongly decided, and your opponents say that you really want to return to a world where Congress couldn't even regulate wheat in the backyard. To what degree does your case turn on the Supreme Court re-examining its entire Commerce Clause jurisprudence that goes back to the 1930s, and why do you think that Wickard should be overturned?
Well, I think it can the Supreme Court can still fully vindicate Wickard, which I think was a 1942 decision, but still rule that this mandate is unconstitutional. Wickard's been looked at, I think, in 95 in the Lopez case, 2000 in the Gonzalez case, that they kind of took the Wickard logic and spelled out a test of what things are both the negative and positive limits of the Commerce Clause. And they essentially said, you know, actions and instrumentalities of engaging in interstate commerce are constitutional. If you engage in activities that affect interstate commerce, then it is permissible to regulate under the Commerce Clause. And I guess that's the logic in Wickard under Jeff's analysis. But this really is inactivity. This statute hinges on a mandate where the United States Congress, notwithstanding the limits of Article 1, Section 8, notwithstanding the 10th Amendment to the United States Constitution, tells every citizen in this room that you must buy a health insurance policy. And if you don't, we will fine you. We will take money from you, a penalty. That's the essence of this law. And I'd say even with the extent and the stretch that the Wickard court took 60 years ago, that this is another stretch. And therefore, there really is very little left that the federal government could not do under the Commerce Clause. They can do about anything else under the General Welfare Clause, but this is like the rest of the enchilada, that there's virtually no limits to be set on interstate commerce and on Congress's power. The reason I say Wickard I thought was wrongly decided is, I mean, all of you probably have grown flowers or roses or something in your yard. Well, under that logic, that would also be interstate commerce, because you affect the interstate trade in flowers, 1-800-Flowers. I mean, you're affecting their business if you grow flowers in your backyard, so they can probably, Congress can tell you whether or not you can grow flowers in your yard. I mean, that's the extent to which that decision logically reaches its conclusion. And, you know, we have a little pride in that Constitution of Virginia, since people like Madison and Mason were instrumental in writing that some 220 years ago. And so those words mean things. If you want to change the Constitution, there's ways to do that with the convention and voting on the ballot, but not by judicial fiat, by extending it so much that it renders the 10th Amendment and the 9th Amendment basically useless. And frankly, Democrat and Republican Congresses, in my opinion, have done that over the last 60 or 70 years, with the court being a willing accomplice. Well, I think that's why we filed this case, why 26 other states joined in Congress, why Oklahoma just filed last month on a separate provision, because they just passed a constitutional amendment to say you can't force your citizens to buy insurance, and why this is so important. So while there clearly are going to be some areas that I think probably Governor Rendell and I will agree on about some of the policies within the bill and maybe the overall aims that we're trying to accomplish, you can't do it in such a way that it eviscerates the Constitution. And I think that's the heart and soul of why we filed the suit, why we passed the statute, and why it's critically important to place these limits on federal power. Otherwise, we're not just talking about health care. You really will be able to regulate virtually any transaction of any good and service in perpetuity at in the United States Congress if this law is upheld.
Governor Rendell, what's the response? I mean, how radical would it be for the Supreme Court to accept Governor McDonnell's constitutional vision? Would it require returning to a 1930s or 1940s understanding of Congress's power? Would it call into question the ability to mandate vaccinations, which after all the court upheld in 1905? They said you can be fined if you don't accept a state-mandated vaccination because it would harm the health of the community as a whole. Would all that be up for grabs?
I think it would open Pandora's box. Let me say, I'm not unsympathetic to Bob's analysis of the Wicker case. I think this is a much stronger case for choosing to not get health care having an effect on interstate commerce than growing wheat or growing flowers in your backyard. I think the fact pattern here is clear. This has a dramatic sledgehammer effect on what we do. Every time someone goes to an emergency room and doesn't pay, it affects every one of us in every state in the union. This is a dramatic effect on commerce. It's real, it's substantial. It's not wheat, it's not flowers. It's a much stronger fact pattern, number one. Number two, you're absolutely right. Of course, this time you're absolutely right. because you're right, courts have upheld mandates all the time. The constitutionality of mandates, we're a society that has tons of mandates. You know, and you have to have automobile insurance. Well, no, it's not a mandate, Governor, because you don't have to have auto insurance. You can choose not to drive your car. Well, absolutely. You know, but it is a mandate. It's obviously a mandate. We have supported and courts have upheld mandates across the board. And if you take, not necessarily the way Bob has crafted it, but some of the people who've made this argument, you're just taking away the power of not only federal government, but state and local governments to mandate anything.
Governor McDonnell, what is the real objection? The hypotheticals about roses and broccoli and gym memberships. Charles Freed testified before the Senate last week, very distinguished former Solicitor General under Ronald Reagan. He said, this isn't really a question about federalism. It's a question about individual liberty. You're saying that you have some autonomy right not to be forced to buy things you don't want to. And that right, if it exists, takes us back to the era when the court struck down minimum wage laws in the Lochner case. It's a kind of liberty of contract, or liberty not to engage in contract. And that's the kind of judicial activism that conservatives used to denounce, making up rights that aren't in the text of the Constitution and creating economic liberties that don't have firm historical roots.
I think there certainly is an individual liberty component to this, but that's really not what's being argued in this case. It is solely an interpretation of the Commerce Clause and the Tax and Spend Clause. The difference that I would have with the governor's analysis is there's a fundamental difference between doing something affirmative, like growing wheat in your backyard, and not doing something, like in this case, not buying an insurance policy. It is different completely, an activity versus inactivity. And frankly, that was the linchpin of the analysis in both the Florida and Virginia cases, and why they ruled that the individual mandate was a violation of the Commerce Clause. The court also has said in various cases that we will not, that we have always said that construing the Commerce Clause in such a way that transforms a statute into a police power is beyond the extent of the Commerce Clause. I think that was Gonzalez. And that's essentially the logic that was used in this case to take a Commerce Clause related issue, i.e. insurance, and turning it into essentially a police power, doing something to legislate the health, welfare, and morals of the people. And the court said, we have always said that's not permissible under the Commerce Clause. And I can't think of anything logically. Forget the salient benefits of the law. And that's a good argument, maybe of some of the things that you like now, and that may be a good political or policy argument, but this is a legal argument. And I still would throw the question out, is what is there left that you can't do under the Commerce Clause if you can make a citizen buy a product of insurance? What really is left that isn't good for Congress to say for the benefit of your health, morals, or welfare that we're going to make you do? And that's really the issue here, is not whether it's a good idea. That's the question for Congress and ultimately for state policymakers, but whether it's legal or constitutional. And I think you always must cross that threshold first, or we really have a Machiavellian Congress that eviscerates the 9th and 10th Amendment. And those two amendments were kind of what got the deal done between the warring factions back in 1789 and on the ratification in 91. Is what are the limits between that very strong central government that ruled from England, and then the Articles of Confederation that didn't hold us together very well for 11 years. This marvelous Constitution was a deal that has worked now for 220 years. It's been a beacon of freedom for other countries around the world. And if we say that for some good, noble idea of universal health care that we're going to eviscerate the fundamental meaning of the Commerce Clause, I think it really is a disservice to us as a nation.
Counselor, your friend just asked a hard question. He said, if this is upheld, there's no limits to Congress's power. Are there any limits? Could they require the health gym memberships?
The cases that have been decided correctly say you can't use the Commerce Clause, or cases where the activity sought to be prescribed had no effect on commerce. It involved, right to possess guns, things like that. You can't use the Commerce Clause to affect something that doesn't have economic consequences. But clearly here we have economic consequences. And lawyers do the best they can with difficult facts, and they're difficult facts here, because it's clear that the choice of not having health insurance has economic consequences. So Bob and others who support this view say, well, there's no activity. Well, activity doesn't have to be physical activity. Do we require a physical act? Do you have to get up and chop wood or something? No, activity can be a choice. A choice is you're being active when you make a choice not to do something just the same way. So the real test is the Commerce Clause doesn't apply to things, cannot be used to justify things that have no effect on economic activity. This clearly does and should be supported.
Buy your broccoli and health memberships now. It's coming.
They'll be cheaper when the government's requiring them.
It won't. That's the other problem.
This is actually a very good mooting of the Commerce Clause issues. I think we've heard strong arguments on both sides. Let's turn to the second major argument against the bill, which is the taxing issue. Governor Rendell said, if this is a tax, then it's clearly constitutional. And he said the fact that some people in the political debate said it wasn't a tax shouldn't have...
Said it was.
Some said it was, and some...
said it wasn't.
The
people who were arguing to sustain it now said it wasn't a tax.
Exactly.
The people who were arguing against it said it was a tax.
Exactly right.
Interesting.
And the question is, what legal effect should that have? Why should a judge care whether in the heat of political debate people change their positions? What's the standard for discerning whether it is a tax or not?
Well, that's a good question, because that's the other basis that the government uses to say that it's a legitimate exercise of power. In other words, okay, Judge, even if you don't buy our Commerce Clause argument, then under the Tax and Spend Clause of the United States Constitution, that because the sanction for not buying insurance is exacting a monetary penalty from you that we're calling a tax, that the tax and spend powers in Article 1, Section 8 give us the ability to enact this law at Congress. I'm just glad at least that the government's conceding Article 1, Section 8 still means something, and that they have to find their powers within that, and that hopefully that Everything else is still reserved to the people in the states respectively. So the argument of the government, and I agree with Ed that there were different political arguments made on the floor of the United States Congress that are now being made by the respective attorneys, because the Republicans were railing about it being a tax. The Democrats said, no, it's not a tax, it's not a tax, until they got to court, and then they realized, well, if the Commerce Clause argument doesn't work, the only way we can save this statute is by saying it is a tax if you fail to buy a product of insurance. But here's what Vinson and Hudson said, looking at a number of cases, and that is that a tax is something imposed upon the people to raise general revenues for support of the government. But a penalty is something different. It is a sanction for not doing something prescribed by law. And if it's a penalty, you can't rely on the tax and spend power. You have to find some other independent authority within Article 1, Section 8 to justify the imposition of that penalty. Well, in this case, the only other independent remedy is going back to the Commerce Clause. So it's kind of a circuitous argument. It still comes back, even if it's a penalty, which it is, you still got to come back then to the Commerce Clause to be able to justify it. And so I think both courts were right. It's not a tax. It's not used to raise revenue. It's used as a hammer to force you to buy insurance, and if you don't, then to exact a penalty from you. So I like the rulings, obviously, of both those courts. I think it's consistent with a body of law that the Supreme Court has passed, and I don't think the tax argument now is going to save the statute.
Governor, does it matter what people said in Congress? And also, is this distinction between taxes and penalties something that the courts abandoned in the 19th century? And ever since the 20th century, haven't they said that, sure, you can tax cigarettes in order to discourage people from using it? In other words, if you really start quibbling about what's a tax and what's a penalty, doesn't that take us back to the pre-regulatory state era?
Well, number one, I don't think that statements made on the floor of the Congress should be dispositive of a legal case, number one. Although you do have to look at legislative history and what the Congress thought they were doing. But I think here, given the partisan nature, if I were a court, I would disregard those statements on both sides. But I think actually, I'll get to your point in a second, but I think Bob actually framed the legal question correctly. But I think the answer is, it is revenue. Of course it's revenue. What are we going to use the penalty for? We're going to use the penalty, it's going to go into the pool to provide increased access. And it's going to go into the pool to soften the blow to private insurers who have to now give coverage to people with pre-existing illness who they could legally disregard before. That money is not going into the general treasury. The penalty is going back into the system itself to help subsidize the entire provision of health care to 31 million more Americans. Bob's argument would be very strong if that money was being directed to the general fund, but it isn't. It's being directed to health care. It's revenue raising for health care. So if I don't sign up for insurance, which would put revenue into the system, I would be paying the private insurers money for, then the penalty is used to help subsidize in other areas. So I think that Bob did a great job of framing the question, but the facts indicate that it is in fact revenue and therefore taxing.
Governor McDonnell, to what degree is this really a debate about existing Supreme Court doctrine, and to what degree are you really fundamentally trying to transform the relationship between the federal government and the states? I gather you've expressed some interest in this repeal amendment, which has been proposed, a constitutional amendment that would allow 3/4 of the states to repudiate any federal law or regulation with which they disagree. I mean, are you just taking us back to the age of nullification, the pre-Civil War era, and you really want to dramatically restrict federal power and not work within the existing framework?
Objection, leading question.
Absolutely. This is the Supreme Court. There are no evidentiary rules.
No,
that's Justice Rosen to you as well.
There you go.
Yes.
Let me answer it in two different ways. One, no, it's about what our founders meant by Article 1, Section 8 and the Commerce Clause and the Tax and Spend Clause. And that's obviously, we got 200 years of jurisprudence that will be looked at. And I just happen to think that under the most favorable view of those rulings, both on tax and spend and on the Commerce Clause, that the government loses in this case for the reasons that I've already mentioned. But your second point still is good, and that is, I really do think that this health care bill, as well as things that have been done for decades by Republicans and Democrats, is engendering a robust debate now, and I think the governor might agree with this, about federalism. I mean, us governors do believe that government closest to the people does work better, I think, as Mr. Jefferson and Mark Twain and others probably said, that the 10th Amendment, the Forgotten Amendment as I call it, still means something and should be respected, and that is, if it ain't in Article 1, Section 8, you can't do it. There's some other clauses that give you a little authority, but everything else is supposed to be left to the states and the people respectively. That was a critical part of getting the deal done in the Bill of Rights. People forget that is part of the Bill of Rights. The first 8 are individual freedoms, but the last 2 are really sort of the social compact between the states that ceded power to the federal government to get the Constitution set, but the people through the states were the ones that were the reservoirs of power. I really do think that we do need to have a robust debate on what are the limits of federal power. I thought No Child Left Behind under the Bush administration was something that exceeded federal power under Article 1, Section 8, just like I think the Obama federal health care bill exceeds federal authority. And so, both on what the Constitution means as well as how do we do good government in America, I happen to think the more it's done by people who are in the states or live in the everyday problems like Governor Rendell and I did, that are close to the business people, that actually go and touch a lot of citizens and get a sense of what's going on with the people, is a better way to do government as opposed to 535 people in D.C. that get together a couple days a week. I just think that's what our founders put together, and that's a very important part of the American experiment. So yes, whether it's directly or indirectly as a result of this case, Jeff, I do think it's leading to a very good national debate about what federal power should and shouldn't be, and the repeal amendment that I have favored in Virginia and other states are looking at it, is a way to start to rebalance that power just a little bit to give a little more voice to the states.
So, Governor, what should the position of Democrats be in this crucial debate about whether our constitutional vision should be transformed? Rather than just quibbling about technicalities about the Wickard case,
sure,
do Democrats need to make a positive case for why you need federal power to protect progressive goals?
First of all, I think what Bob said has a great deal of credence to it. I think the pendulum has swung far too far in many areas. Unfunded mandates, for example, and the big problem with No Child Left Behind is passed by President Bush with Senator Kennedy's help, was it laid on the states a tremendous amount of unfunded mandates. In fact, they actually promised to fund the things that the states were required to do, but for a whole lot of reasons it never came to pass. Right. They never came close to putting the funding level in that President Bush suggested at the opening press conference. So those mandates are killing us. The mandates here on many states, and it differs state by state, will have a dramatic effect when Medicaid expands, when we raise the level to 133%. Will have a dramatic effect on the states. And although they start out with the federal government taking most of it, 98%, gets down to 90% by the end of the decade. And that's a huge problem for a lot of states that are already in difficult positions. So mandates are a huge problem. States and cities got together in the late 90s and got the Congress to pass and President Clinton to sign an unfunded mandates law, where there are supposedly limitations that any senator or congressman could literally raise his hand and say, this is an unfunded mandate, and you have to have an extraordinarily high percentage of votes to pass it, and we have to examine the consequences on the states. I don't think anybody has ever, any congressman or any senator has ever put that law into effect since it passed. Mm-hmm. They treat unfunded mandates in Washington like they don't exist or they're not a problem. They're a huge problem for us. Taxation, another area where we've got to redefine the limits between the state and the federal government. We're not allowed to tax internet sales. There's been a moratorium on internet sales. Well, internet sales is absolutely eating our sales tax alive, And to me, that's hugely unfair. So I think state and federal relationships ought to be reexamined. I think Bob makes a good point. But there are some things that are so national in scope that I think the federal government has to do this. I don't think you could have workable in this country 50 separate healthcare delivery systems. It's just not feasible, folks. There are some things where the federal government, and I think our framers understood that, and that's why there are these avenues for broad federal legislation. It should be used carefully. It should have consideration for mandates. Mandates are one of the problems that governors, both Republican and Democrat, are worried about this bill. But there are some things that absolutely inherently lend themselves to federal action. They can't be done anywhere else. You can't build a high-speed rail network by 50 states building a high-speed rail network. You'd have maglev in one state, Pennsylvania would have maglev, and then at the Ohio border, you'd have to get into a whole new train because Ohio has LGV. It just doesn't work. Some things lend themselves to federal action.
Which is just what happened in the days of Lincoln on his way to his inauguration. He had to take one train, go across town, go to the other train station, pick a new line, and continue along. The good old days, huh? It warms the heart.
Our first Republican president was glad to. He would have walked.
Right, absolutely. Last set of questions, and then I know our audience has plenty. Let's imagine what happens going forward in both events. First, Governor, if the Supreme Court strikes down the mandate and Congress goes back to the drawing board, is there any health care reform you would support? Do you agree with the goal of universal coverage in principle, but prefer that it be done by the states or by a single payer? I mean, give us some sense of whether you in fact would support a revised health care bill without the mandate. And then if the Supreme Court upholds it, will Virginia implement the exchanges in good faith, and what will happen then?
Well, in the second part, I've already said, look, it's the law of the land. Even Judge Hudson's ruling didn't stay it. And so, as far as I'm concerned, it's still the law until there's a final action. And then the pragmatic issue, as Ed mentioned, is it's going to take us 3 years to set up exchanges. And I don't want the federal government doing exchanges. So if we've got to do it, I want to do it at the state level, like I think most states probably do. So we're starting now. We started a healthcare reform initiative 6-7 months ago with my Secretary of Health, Dr. Bill Hazel. And we're working on two things. One is, what's the best way to implement this 333-page bill in a way that's most favorable to Virginia? And number two, what are the other things we can do, whether or not there is a federal health care bill, on everything from prevention to more health care providers, to doing something about the incredible growth in Medicaid, to any number of other things that are truly state-level issues somewhat unaffected by this bill. So I intend to follow the law, whatever it is. I just want to find out now, not 3 years from now. On the second part, I would say that there's a lot of agreement, I think, in the country about the need to make reforms in health care. I mean, let's face it, the federal government controls about 50-60% of the system already between Medicare and Medicaid. They fund all of Medicare, half of Medicaid, and then they've got other different rules out there that affect insurers. The states have any number of laws affecting insurance policies as well. So the government is deeply into health care and health insurance and health financing already. I think that there are some alternatives that I hope my party will propose, that Paul Ryan and John McCain and John Boehner and others have already talked about a little bit, that can improve the system, whether it's tort reform. Let's not forget about that. Something actually President Obama talked about in his State of the Union speech, which I thought was commendable, buying policies across state lines, any number of other things that could be done at the federal level. But again, I think the states really are going to be the best ways to do that. I disagree a little bit with the governor. I think that we have any number of different systems in our 50 states for any number of different services or policies, and they work quite well. I'm not sure that we do need to have one uniform national health care policy. You know, a doctor in Seattle, Washington, and what they face is very different than what a doctor might face in Abingdon, Virginia. And we've got different needs, and I'd rather have my team in Richmond, Virginia, determining health care policy for Virginia. So I do think it's something best left to the states, and we're working on a series of initiatives right now, because this federal law was really more about health insurance and finance reform more than it really was about health reform. That is, and back to Ed's point, I mean, just to give you a perspective, Medicaid reform is critically important in every state. These are now budget-busting appropriations. In Virginia, our Medicaid system has grown 1,600%, 1600, over the last 27 years. That's before this new federal health care bill. It now consumes 22% of our total budget, up from 5% 27 years ago. With this bill, I'm looking at another $2.2 billion over the next 10 years. That'll get us up to 27, 28%. Other states are already there. So it is a huge fiscal impact for both the federal and state governments that I think are virtually unsustainable, and we've got to find ways to be able to improve our Medicaid delivery system. We've got to have more health care providers, especially in rural areas. We need to look at scope of practice to be able to get more people to do more things, maybe at a lower level. We've got to drive down the cost of medical education. I think all those are things that are best done at the state level.
Excellent. Same question, Governor. Moving forward, imagine first the court strikes it down. Is there any bill that you would support? What would it look like? And if the court upholds it, might there be tweaks or reforms that could bring both sides of the
Let me start out by saying, in all respect for Bob, who I think is done a great job in Virginia and it approaches things in a very common sense, bipartisan way. It's not working. We've got 1 out of 9 Americans in the richest country in the world without health insurance. That's national disgrace. That's something we should all be ashamed of. Good grief, it's not working. In Pennsylvania, companies, private companies operating through the private insurance system have dropped 700,000 people from health insurance in the last decade in Pennsylvania. That's continuing. Health insurance costs are exploding. Individual premiums are exploding by 130%. Group insurance premiums growing by 120%. It's not working. Our 50-state system is not working. The system is absolutely broken. It's broken not just in two, it's shattered. And we've got to do something. Good grief, we're Americans. We take care of each other. If every other developed nation in the world can have universal health insurance, why can't we? Why can't we? Is there something wrong with us? So it isn't working, and we do need a broad solution to it, number one. If in fact the bill is declared unconstitutional, we can do, and perhaps we should, we can start off with how to make healthcare more affordable. Bob talks about scope of practice. Unleash the power of nurses. Nurses can do virtually, not everything, but a great deal of what a primary care physician can do at a much lower cost. Unleash the power of nurses. Let's do something about hospital-acquired infections that are killing the system. Pennsylvania has cut our HAI costs to the delivery system by 8.5% in just 2 years of having a tough HAI. Chronic care, 20% of our patients cost 80% of the cost of the delivery system because we treat them after the fact. Let's start getting modalities that treat them from the beginning, that manage their illnesses, that cut down on the big hospital costs later. It's been proven successful. We've done it in asthma and diabetes and have great results in avoiding hospitalization and avoiding ER visits. I think we could all agree on that. The idea Bob mentioned about letting insurance companies compete everywhere, that's okay. I'm for that. Governor Pawlenty had a great idea. We have to have some standards, though, some minimum standards. I don't want to, in Pennsylvania, we cover autism. We cover autism. I don't know if Virginia does.
Just passed the bill.
We cover autism. Not only autism for kids, but autism for adults as well. I don't want some insurance company coming in and offering a product that doesn't cover autism. That should be my decision. States' rights, that's my decision. That's my decision and the legislature's decision. But can we do like we do in insurance and have states sign on to a national pact and have broad standards? And if the insurance company is willing to adhere to that national act, they can come in and sell in your state? Yes, I think we can do that. But the bottom line is, so we can do that. Can we do insurance reform? That's the most popular part of this act. Can we do insurance reform? Not without the mandate or something else. And the something else drives up the cost. I can tell you how I can make sure that you can't be disqualified for a pre-existing illness, child or adult, and I can make sure that we remove the caps on yearly care or lifetime care. The federal government has to be a stop loss. After a certain amount of medical care each year, The federal government picks up 75% of the cost. That would replace the mandate. It would absolutely replace the mandate. The insurance companies could live with that. They could offer coverage to everybody, no limitations. But guess what? The Dire Straits song, Money for Nothing, isn't true. There is no money for nothing. It's going to cost for us to do that without an individual mandate. That's the great irony. The individual mandate actually holds down the cost of the overall cost of a health care bill. So we've got to find a substitute. We can do affordability, we can control costs, and I think we should. Maybe that should have been step one in the bill. Two, we can do insurance reform, but we have to have a way or else we're going to drive the private insurance companies out of business, and that's going to be single payer, and single payer is anathema to a lot of people. I don't think I'd like to see single payer. I'd like to see a private insurance system with the right type of regulation in place to make it work. And then lastly, how are we going to expand accessibility? Ask Mr. Ryan, Congressman Ryan, ask all of them, what's their plan for accessibility? Health savings accounts don't work for people making $22,000 a year, folks. They don't work. They don't work for people who are working at minimum wage. They don't work. Let's get real. How are we going to expand coverage in America? Those are the questions we have to answer. If the bill is held to be constitutional, we need absolute changes. The Congress should get together with the president and with governors and talk about ways to control costs. There's some cost containment in the bill, but not enough. The basic things that Bob and I have talked about should be in the bill. They're not. We should get them in the bill. We should make the administrative changes necessary. We should do a lot of things, but we should do them as Americans. If we do them as Republicans and Democrats, whether it's the run-up to the 2012 election or the 2014 election, it'll get screwed up. It'll get screwed up. You can count on it. You can count it. We have to do it as Americans. Either way, we've got to be honest. But let's be honest. If we're going to cover Americans, and we ought to, I think it's a national imperative, it can't be done without some cost.
Very good. Well, with that surprising degree of some policy agreement and some vigorous constitutional disagreement, we're now ready for questions from the audience. Yes, sir. Gene Myers.
Yeah, Gene Meyer, Federal Study. I have a question. One of the standard things with any of these healthcare provisions is that you have you get to a deductible very quickly, and then there's essentially no marginal cost for the consumer. And in almost any area or product where you have no marginal cost, the product tends to get overconsumed. How would do you see that as a problem, and how would you suggest addressing that?
It's a huge problem. It's human nature. If you don't have to pay for something, you want the best you can get and you want more of it. And that's a problem with Medicaid, Medicare, a lot. If there's nothing to constrain yourself other than your goodwill and good choices, unfortunately, you do get overconsumption, overutilization. One of the problems with Medicaid that all governors face is the worst and most expensive place to get routine health care is at the emergency room, but that's sure where a lot of people go. And that's part of the education of the population that is entitled to those benefits, where you need to do some training. I really think, and I know some people don't like this, but we ought to have some participation. If you have skin in the game, you make choices differently. And for people that are Medicaid, even $1 or $2 or $3 or something, we're looking at pilot programs this year that I put in the budget in our General Assembly to change our Medicaid provisions a little bit, to have some different rules for recipients, to give them some incentives to help do prevention, to help control costs, so that they are involved in the choice, because otherwise the sky's the limit. I think you're exactly right.
Yeah, it's a great question. Bob's exactly right. See, when I was mayor, we had a big discussion about item pricing at supermarkets. Seniors would go in and literally they'd want to be able to check every price on the shelf, and then they'd get their bill and they'd almost take out a magnifying glass and check the bill against the items before they'd leave the store. And yet they check out of a hospital and don't even look at their bill.
You don't know.
Don't even look at their bill. And the bill might say 2 aspirin, $22, and they don't even look at it. They don't look at it. So we have to, first of all, we have to make employees contribute more. I think everyone's doing it now. When I became governor of Pennsylvania, our employees didn't contribute to their health care. Well, they do now, but we give them a chance to earn back 50% of their contribution by meeting health standards, by meeting personal health standards. It saves us money, and it obviously saves them money as well. So participation, Bob's exactly right. And I think we need to have co-pays, and where we do have co-pays now, raise them a little bit. Raise them a little bit. One, it helps get money back into the system, but two, skin in the game. It's probably the only thing we do in the country where the consumer doesn't care about the prices right now.
Or doesn't even know.
Doesn't even know.
Yeah. Ed's point is also very good. We have really under-focused on prevention. There are 5 or 6 of the most chronic diseases from diabetes, heart disease, cancer, some other things like that are driving the lion's share of our health care costs. And many of them are either preventable or at least can be mitigated dramatically in expense and human suffering by early detection and prevention. So we've got to find better ways, both with education and insurance coverage, to do everything from diet, exercise, nutraceuticals, the pap smears, the other tests, PSAs. There are a number of things that if we do well, we can find these problems at an early stage and then dramatically affect the cost curve down the road. But it's going to take insurance companies covering a few more of those and then a lot better education. And again, people taking, your health care is your responsibility. It's not the federal government's. And so the more you do to mitigate your own risks, the better you're going to be in the long run. And we've got to find a better way as a society to do that.
Yes, ma'am, in the back.
Hi, I'm Melissa Goldstein. I teach public health law at GW. Naturally, I want to go back to Jacobson versus Massachusetts. We know that for about 100 years, it has been constitutional that Congress can legislate in the area of public health. So I'd like to go back to the question of activity. If we're worried about people that are well, perhaps doing nothing, maybe inactivity, maybe activity, and mandating that they buy insurance, what about the people that do something, right? The smokers, the eaters, even the motorcyclists who don't wear helmets, right? Can we mandate that they buy insurance? Because that is activity. It's closer to activity, or it's an easier definition of activity.
Let's not always see the same hands.
I'm not sure. Again, I think everybody should be mandated to either have insurance or buy it, so that would cover all the wrongdoers as well. But could there be penalties for the wrongdoers, higher premiums? Absolutely. Absolutely. And I think, can we mandate that? Absolutely. I think it's something states should do, the federal government should do, who's ever in control. No question about it. Because those clearly have consequences and it's clearly activity. So I think it's within the purview to absolutely do that. No question.
Well, where do you draw the line? Smoking, drinking, those are sort of easy. Next, we're going to have the food police, to tell you if you go to McDonald's twice a week, you're going to pay extra premiums.
But you could do weight. You could do weight, right?
You could do weight. Okay, well then we get into the area. What about various sexual behaviors that have various proclivities towards disease? What about if you're predisposed to a particular thing because maybe you have the BRCA1 gene and you're more predisposed to breast cancer? I mean, I don't know. That's why we have pooling of risks in insurance so that we don't do that per se. But I don't know. It's a tough question. I think under state laws and constitutions, you might have the authority to do that. I still don't think the federal government ought to do it, but you have some really tough policy choices as you get from maybe the easier ones down through the list of risky behaviors, and what are you going to legislate, and what are you going to penalize people for? So that's tough.
There was a state judge recently who struck down a state law requiring the use of helmets for motorcycles. Was that right or wrong?
Well, we wouldn't have passed it in Virginia.
You're prohibited from wearing helmets.
We like the wind blowing in our hair.
Absolutely. Absolutely.
No, I think...
it was in New York. It must have been a New York law. One of those.
It's probably a matter of state constitution and obviously the policymaker. They could probably do that under the police powers of the state. They could do it. We've killed those bills in Virginia.
Very good. Yes, ma'am. Here up in front. Oh,
Hi, my name is Ednan Mushtaq. I'm a physician in Northern Virginia. Question, more of a comment also, that both governors have commented about allowing the nurses to do more, and so on and so forth. And I think that there is going to be a significant need at primary care level to provide that level of care, but I would caution about allowing a wider circle of people to be fully responsible for patient care, because I think that there's a reason why medical school has so many years of training and so on and so forth, because speaking as a specialist also, I will tell you that when I deal with multi-group practices, the number of referrals to specialists from the nurse practitioners, the PAs, are probably fivefold more than the primary care. So on one hand, the administration has a goal to have medical homes where the primary care physicians will take on more and more of the responsibility, more and more of the care, so that way we decrease costs by sending less patients to the specialist. But if you have individuals who are the gatekeepers, who are the least trained at the entry level, they will have a lot more anxiety and will transfer the patients up the line much, much easier, and therefore the total cost of healthcare will actually go up, because you have less trained people who will feel more uncomfortable without any tort reform and whatnot, making decisions on difficult cases. So I think that those are two opposing ideas that I keep hearing at the national level debate and at the state level debate, how we're going to remedy this crisis of primary care deficiency of providers by just letting nurse practitioners do all the work. But I think I would caution them and say that that may actually increase the costs as those people have less comfort levels.
Well, let me just respond to that real quickly. Number one of the problems is we're running out of primary care physicians. We don't have anywhere near enough, particularly in rural areas in the state and some underserved urban areas. So it's not a either or, it's what we've got, number one. Number two, we've expanded the scope of practices for nurses since 2005, and it's had a dramatic effect in decreasing healthcare costs. I haven't seen any incidences of more referrals to specialists, because our law still requires those referrals in a level of illnesses to go through a physician. But it has dramatically reduced the cost of care. For example, we now have alternative to emergency rooms. Everyone thinks emergency room costs are just from the uninsured. Nope. It's from we, the insured, because we've designed a healthcare delivery system that's open from 7:30 in the morning till 4:30 in the afternoon. If something happens to you at 8 o'clock, it can be the most routine thing. You know, your dog bites you in between the fingers and you need 2 stitches. You have to go to an emergency room. They give you some gauze and say, they utter the most feared words in the human language, "We'll be with you as soon as we can." 4.5 hours later, a physician cleans you out with, I say mercurochrome, they don't use mercurochrome anymore, but cleans you out and then stitches you, gives you 2 stitches. Well, why don't we have a second room in all hospitals, staffed by nurse practitioners, physician assistants, where the admitting surgeon can refer people to. They take care of you in 30 minutes for 40% of the cost. Well, we've got now clinics in big box drugstores and in some big box grocery stores as well, where nurses are on duty and administer the same treatment up until 9 o'clock at night, and gosh, open on Saturdays and Sundays too. And costs have gone rocketing down.
We have time for one last question. Yes, ma'am, right here up in the front.
Hi, I'm Sarah Cliff with Politico. I was wondering if you could address what we've seen from Governor Scott down in Florida, the attorney, could you hear the beginning of that? Okay. The Attorney General in Wisconsin saying that this case, the ruling in Florida, absolves them of their responsibility to implement the law. Obviously, you take a different view on that, but I was wondering if you could speak at all to how it's being interpreted by those officials.
The Florida case is a little different than Virginia. Judge Hudson's ruling in Virginia didn't go as far as Judge Vinson's in Florida, and so I'm bound by the Virginia case, which struck down the individual mandate. To some degree, Judge Hudson's ruling didn't even go far as the concessions of the Justice Department, which says if the individual mandate falls, then we concede that all the rest of the insurance regulations go away. Judge Hudson's ruling was fairly narrow, striking it down, and did not enjoin or stay the statute because he said most of them aren't going to be in place for 3 years, and so I expect people to follow the law, but by that time the appellate stuff will be worked out. In Florida, though, it was a little broader. He struck down the entire statute because he found there was no severability clause, and based on the case law, I think the Alaska Airlines case, he said, can't find any other basis to say that this would be a consistent law without the stricken provisions. And by the way, I expect people, I didn't issue an injunction, but I expect people to follow my ruling. So I think the interpretation of the governors that were planning for that case, the 25, 26, doesn't apply to me now. And we're not doing anything. Some will make that decision. Some, I think there's an interesting difference of opinion among the governors that were plaintiffs. But I'm in a different position in Virginia. And just practically, I think if you don't start now in the individual, exchanges, excuse me, thank you. If you don't put those, start right now on those, I know the governor started last year, we started at the end of last year, you're not going to be ready for 2014. The last thing I want to do is have the federal government run these exchanges if the law is upheld. So that's why my approach is we're going to continue with the process of implementation, but let's agree, as the governor did, let's agree on getting this thing to the Supreme Court immediately. Let's get an answer so we create certainty and finality. So that's our position.
Yeah, and I agree strongly with what Bob said. I'm going to contact Governor O'Malley, who's head of the Democratic Governors Association, and say,
I got a cell phone right here.
say, we ought to be signing on. It's just common sense. Let's get this done. I mean, if what you say is correct, it's unfair to the people of Florida to wait for 3 years. And then what are they going to do? If it's held to be constitutional by the Supreme Court, they won't have any exchange in place. What's going to happen? That's not fair. So let's get this thing decided. I think if the Supreme Court took it, it could be argued certainly in the fall session, and we could have an opinion maybe by the beginning of next year, by the beginning of 2012.
That's right.
Yeah.
Ladies and gentlemen, it's often said that our elected officials are unwilling or unable to discuss issues in constitutional terms. We've just seen a powerful counter-example of that. Please join us in thanking Governor Rendell.
Good job, man. Thank you.
Very good job.
I'm going to call Mark.
I didn't get it.